Hello again, thanks again for coming to Cancer Logic. My name is Karn Log, and today I'll be answering a question that I often get from patients is, well, my doctor told me that I had a blood disorder, so why am I actually seeing a cancer specialist? One thing that you'll often notice is that cancer specialists or oncologists often also practice hematology, or the study of blood disorders. And what do those two fields have in common, and why do the same doctors practice that? And so a common analogy that I use is basically, well, think of actually the most critically ill patients and who actually takes care of those patients as well. So the one factor that the most critically ill patients have is that they will often be on a ventilator. So who takes care of patients who are on ventilators? It's not surgeons, it's not ER docs, it's actually pulmonologists. So pulmonologists have specialty training where they actually treat lung disorders as well as the most critically ill. So that is actually kind of how hematology and oncology have in common. So for the longest time, there was a field of hematology. We were studying blood disorders, anemias, low blood counts, low platelet counts, and that has actually been studied for hundreds of years. But we really didn't have a lot of treatments for cancer until World War II. We then started discovering that nitrogen mustard actually caused a lot of problems in our soldiers where they would actually have very, very low blood counts. And so there was actually a discovery where we would actually be able to use nitrogen mustard to actually help treat patients with blood cancers like leukemia. And when they finally discovered chemotherapy agents, well, what is actually one of the most common toxicities of chemotherapy agents? And that would actually be blood toxicities. And so, well, who better to take care of a drug or sets of drugs that cause blood toxicities than the hematologist? And consequently, the field of oncology was born. And so now every time you see an oncologist, they are usually also trained in the field of hematology or blood disorders. So hopefully I was able to answer a question that's been lingering for you. Again, feel free to comment, feel free to answer any other or ask any other questions you may have. Thanks again for watching Cancer Logic. My name is Karn Log, and I appreciate your time and feedback. Thank you.